It's a pupil-free day today, so tomorrow is going to be the real test. We are asking parents to drive their kids to school, and if possible, we're expecting about 200,000 extra school kids on the transport network, so we'll be carrying over 1 million people. So it's really important people follow the rules. If you have the slightest hint of a runny nose or even a cold, whatever, don't get on the public transport network. It's common sense. Go get tested. If your child is unwell, don't put them on the school bus. Get them to a pop-up clinic. I mean, that's what we all need to do, and it's just vitally important this week.
Are you going to reduce the capacity in the public transport network on the back of this warning, Minister, or are things going to remain the same?
Well, in actual fact, we've gone the other way. We've put 3,300 additional services on, which is providing us an additional 200 spaces so we can try and provide more physical distancing on the network at this time. You know, we have to be realistic. We know people do need to get to workplaces at this time if they can't work from home. So we do need to run a network, which is why we've got the green decal, the green dots on our seats, and we've got marshals out there. We're encouraging people to use their smartphone technologies to see what the load data is on their services, and we're asking people to retime their day. If they can travel in the middle of the day, that's far better than travelling in a peak period. We're asking people to work from home. And also, of course, I'm telling people to walk if they live in the inner city, or ride a bike, or drive where possible.
If this outbreak worsens, and it seems to be tracking that way at the moment, and I'll ask you a bit more about that in a second, but is that the point where you start reducing the capacity of public transport, or are you committed to kind of leaving things as they are despite whatever happens?
Look, at this stage, we clearly have to follow the health advice, but you know, we have upped the services deliberately to try and put more spacing between commuters. And I have to say, I mean, the travelling community over the last couple of months have been wonderful. They've worked with our frontline staff. We're not aware of any community transmission because of mass transit. We want to keep it that way. We've put a really good plan in place. And we're just going to continue to monitor it and continue to work with commuters. I have urged people who travel in the early parts of the morning peak, particularly on some of the train services, a dozen or so services where, you know, we are seeing a lot of people on board. We'd ask people to retime their travel, asking workplaces to be, you know, mindful that we want people to not get on a crowded train or a bus. They might have to wait for the next service. That, of course, can delay people's, you know, arrival time at workplaces. Just if everyone can work together, show kindness, be great to each other, that's the best way we can get through this.
And should they be wearing masks in public transport?
Well, look, the Chief Medical Officer in New South Wales has indicated to the community, if you can't physically distance, then, you know, consider wearing a mask. We don't have the rule like Victoria does where it's mandatory and a fine attached. But, you know, we've got to be governed by the medical experts in this regard. We don't have the advice from a government perspective at this stage. But, you know, what observation I'd make is a lot of people are starting to wear masks across the community. I think that's a good thing. And, you know, again, when it comes to public transport, we're trying to encourage people to space out as best we can so people aren't breathing on each other in a crowded train carriage or on a bus.
Yeah, and you just referred to this. I know it's not your call, but do you expect New South Wales to kind of follow Victoria's lead and make masks mandatory if people are outside?
Look, you know, I can't speculate, Peter, but what I would observe is that I think people are starting to do this of their own volition. I think that's a good thing. We've got the Chief Medical Officer giving the clear advice to New South Wales residents: if you can't physically distance, consider wearing a mask. But more importantly, I think we've got to also look at the key principles here, and that is, if you're feeling unwell, go get tested. If, you know, practice good hygiene. Go back to some of those fundamentals which have, you know, ensured we haven't seen large-scale community transmission in New South Wales over the last couple of months. Let's get to those fundamentals as well, because we can't just sort of think that masks are going to be the silver bullet. They're not. And it's really important that we just continue to follow all advice of our health officials around the nation and, of course, here in New South Wales. OK.
Minister, we've been reporting this morning about this outbreak in Batemans Bay at the Soldiers Club, which is in your electorate. Have you got any new information on that?
Yeah, it's my hometown. We've been through enough this year with fires, but to now have this circumstance. It's an evolving situation. We know that one of the staff members at the club has contracted the virus. We've seen pop-up testing undertaken throughout the course of the weekend, so it is an evolving situation. There's around 8 cases that are linked to the original cases that were sourced last Monday evening in the club. So there's been advice go out that anybody who attended the club last week to isolate, get tested, look for those vital signs. In a community of 16,500 people, we're literally now going to see hundreds of people having to isolate immediately for 14 days. Even if you get a negative test, you've got to continue to isolate. The other concern, of course, Batemans Bay is a tourist town, and there would have been a lot of visitors, at the club last week with school holidays. So it's a message that has to go right out, in many ways, statewide, nationwide, that this now has a challenge as a venue. But ultimately, the community need. I know there's a lot of fear in my community at the moment, and I'm seeing that through my social media. But please, everyone, just follow the advice, get tested, isolate, and let's try and ring-fence this as best we can.
Have you been able to speak to the club?
Yeah, look, I had a text exchange with the general manager over the course of the weekend. I know since Friday they have worked around the clock with the health department in terms of the club. It is a bedrock of our community, the Soldiers Club, but it's key as this evolves that everybody just get into isolation who was there last week, follow the advice, and let's try and keep people safe.
Are you confident that the authorities are able to get in front of this?
Well, I mean, look, the key element of this is the identification of the 2 individuals last Monday has led to more testing. They've got associates and close contacts of that family, which have now obviously contracted the virus, and family members and 1 additional source. 2 other diners, a staff member at the club, have now also been identified. So that's why it's key that people get tested. That's the best way to deal with this evolving situation. Isolate, that's key. I know there's complacency creeping in across the community. We saw it in an instance of a party in Sydney on Saturday night. Complacency kills. In the case of a pandemic like this, complacency will kill people. So it's key that everybody plays their role and plays their part to look after themselves and their loved ones and their community.
And just more broadly speaking, I mean, you brought that party up on the weekend, and there's been other incidents like, well, not as bad as that one, but, when people are dropping their guard and they're going out and they're not social distancing. Meanwhile, this pandemic is starting to spread and it's kicking up a gear in New South Wales. Are you expecting things to worsen? I mean, how are you reading these numbers at the moment? They've been in double figures for a few days now, and that's what happened in Victoria, and then all of a sudden it jacked up to 70 and 80 and it was off and running. Are you expecting something similar here, or are you confident that you've gotten in front of it?
I think everybody would love to know the answer to that question, Peter.
Yeah.
We are, I think, we're at a very much a fork in the road in terms of New South Wales. It's going to potentially go one of 2 ways. But this is why the Premier has said we all need to be on high alert. That party on the weekend, I'd ask every individual who was at that, yes, you're going to get fined, but actually reflect on what you've done. I mean, you're putting others at risk by behaving like that. And I know it's a real challenge for everybody. We naturally, as human beings, we love being in contact with each other and socialising and what have you. But right now, this is not a time for partying. We are in a very serious situation in New South Wales, particularly. It's a juncture which we don't want to be in, but we are. And the best way for us to all work together on this is to follow the advice and, practice good hygiene and physical distancing.
And just finally, Minister, these attempts to perhaps shift borders, I don't know if it's your portfolio or not, but there's an attempt to shift border in Queensland and also Victoria to ease that traffic congestion. Is that something that you would support?
Look, again, I mean, New South Wales has right through this pandemic has wanted to have the borders open. We've had a very difficult situation arise because of the closure of the border with Victoria, with good health reasons for doing so. And that's the key to this. The borders are the borders. So, to that end, we've got to obviously continue to work with those cross-border communities. I'm a Member of Parliament with a cross-border community. I know the challenges. I know what effect it's having in terms of the locals who live near borders. But again, particularly with Victoria. The reason New South Wales is doing this is because of what's happening in Victoria on the basis of public health, and we've got to save lives. And I know it's more disruptive for border communities, but in many ways this is about saving lives, and that's what we've all got to remember. Despite the frustrations we might have, I continue to just want everybody to be kind to each other, be patient, work with our frontline staff, wouldn't matter if it's police or nurses or our pop-up clinics. Just be kind, because it's a time where we need to reflect and take some responsibility for our own individual actions to make sure we can beat this thing.